views, thoughts, and opinions expressed in this episode are that of the guest and host and do not necessarily reflect the values of sponsors or other associated organizations. Welcome to the Parental Compass by Family Education and Support Services. I am your host, Bobby Williams. Please subscribe to the show. We drop episodes often and we want to be sure you're notified. Keep in touch. Today is part 2 in our 3-part series about community-activated prevention. The concept is that before someone reaches a crisis point, before they're in the hospital, before they're dying of substance use, there is a chance to intervene and prevent this from happening. Today, we are bringing it home by talking about families. We're talking about what you as parents can do to practice prevention to help your children to develop into healthy and successful adults. Our guest again is Capra Parker, a senior community prevention specialist who has worked with communities across the country to implement new prevention strategies. We cover a lot of ground in here. I enjoyed this conversation. Check it out. How can families take a more active role in prevention? What does that look like?
Well, I think there are specific things that families can do, and I'll focus in on 5 and we can kind of break these down. But tangible, like what could you do starting today? One is holding family meetings. Number 2 is communicating your health beliefs and standards that you have for your children or those that you're caring for. The third is managing conflicts positively or well. The fourth is teaching refusal skills. And then the last one is creating opportunities for involvement.
So let's start with that idea of family meetings. I'm used to family meetings coming up when there's trouble, like family meeting. It's like, oops. But okay, why is a family meeting good? What benefit does that have? And what does that look like? What even is a family meeting?
That's true. I mean, I think many of us are used to kind of that concept of like, it's like everybody getting here now. But family meetings really provide an opportunity to communicate without distractions. It's kind of bringing this idea of business into the home, but even having a couple of agenda items that you want to address that maybe the kids want to bring up or the parents or caregivers. But it's this time where you're focused in on the needs of the family and having the conversations. I think we think of them formally. Let's all sit down, or, together in the living room, and I think that's great. But really designating that time to talk about things that matter, and like you said, not waiting till there's a problem, but using this as a regular opportunity to check in, communicate, and build skills.
So is this something that would happen on a regular schedule, like once every other week we get together for an hour and have a family meeting?
Honestly, it depends on what works for your family. We're not very prescriptive in that way, but thinking about maybe it is in time for big changes. Maybe you do it monthly, maybe you do it weekly or bi-weekly. But that's the beauty is figuring out what is the right rhythm for your family, but just kind of figuring that out and making a priority.
What are you talking about these family meetings then? You kind of touched on this a little, but what's important to bring up in family meetings and what's the benefit of them?
I feel like there are a lot of things, but when we're thinking about prevention, this could really be a good time to talk about what are our expectations about substance use, what are our expectations around violence. It could also be a safe space to think through, like if you are having certain feelings that are associated with mental health challenges, that could be a good space to kind of, have those conversations as well.
So you're kind of segueing into the next idea, which is communicating your beliefs and values as a family. So I'm hearing things like we're not drinking under 21, we're not engaging in violence. What are other important beliefs to try to get across? And how do you show that you really mean this too?
Yeah, you know, The first step to family meetings and beliefs is getting clear on what are your beliefs as a family. You know, we when we think about specifically, let's think about what's called guiding good choices. What I love about that program is a program designed for caregivers to get some of these skills we're talking about today. And what I love about that is really thinking about what do you value as a family? What are your beliefs? What are your expectations? And so you will find that people kind of do have varied beliefs. And when we get to this idea of like adults might be doing certain things, but they might not believe kids should be doing it as well. But sometimes they hadn't thought through that. And so it's more so about what are your values, what are your beliefs as a family, and communicating those. And they can vary a little bit from family to family, and they should. I mean, that's what makes the world great. So it is, but it's more about what are your values and communicating them. Now, we do have plenty of research about certain things, and people will lean into that different ways, but really establishing your family's beliefs and standards is important.
Sometimes that might make you do a little check in with yourself too. Like a lot of times we'll have different beliefs, but we haven't put it on paper of I believe XYZ. And you're assuming that your child might already know that, but maybe you've just never communicated it.
Absolutely. I tell people all the time, you really cannot leave it to chance with young people. You can't assume that they know what you believe or what you think. One of my colleagues, she talks about this all the time, her time as a high school chemistry teacher, and how the students would come and talk about their partying on the weekend. And they thought because she was a fun teacher, that she was okay with their partying behaviors, the things that they were engaging in as parties. And so she realized she had to be very clear in saying, hey, that's not safe. You know, that could lead to this. And the kids were shocked. They were like, oh, we didn't know you thought that. And so it's just that aha, like we can't leave it to chance. We have to tell them.
That's a great point. Conflicts come up in families. You talked about managing conflicts in a healthy way. What is a healthy way versus an unhealthy way? And what are common conflicts you see coming up?
Yeah. So this idea of conflicts is really this idea, how do we express our anger? It's normal to feel angry. I mean, everything is not all roses all the time. But when we get to that feeling of anger, how do we communicate that and how do we express it is really the key part that we focus in on. We like to break it into four steps. So the first one is like identifying how you feel in that moment, or saying how you feel to that person. So, Bobby, you really made me angry today, right? You might say it, name the feeling. The second is identify the specific event. So, what happened that led to that anger? Then the third is explain why that event led to that feeling. So, you know, when you said that, that made me feel this way. And then the last step is to explore what options to solve. So it's really about making sure that this communication piece is present in that experience of anger. And you have to teach it. I mean, we're not, I don't know. I have a 7-year old and a 3-year old and a 22-month old. I have learned you can't leave anything to chance, and there's so much you have to teach that you didn't even think you had to. And so this is one of them.
Well, I think this makes you slow down and think about, okay, what happened? What's the real issue? What are we going to do about it? Versus yelling or just being so in your feelings.
Absolutely. And it allows you to be productive with your anger, right? To move to solutions is a big one. To get from this feeling of anger, but to a place of solution.
Sometimes, I mean, you're saying you have young children. Do you ever feel like it's worth it? Like, I'm just going to scare them and blow up, and then they won't do that again.
I would say that is a school of thought, and probably because I'm so immersed in this field, I already know that that won't be the most effective. But I grew up in a time where, you know, that was kind of the method. And so I do understand where that comes from. And I think, you know, we talk about this idea of communicating beliefs. Sometimes you get a chance to stop and think about why do I even believe that? You know, like, is this real? Or are there other options as well?
Well, I think what you're touching on too is so many of the ways you think about parenting can come from how you were parented. And is that a universal truth that that's good, or is there time to adjust? And I imagine too, this is something you actively work on. Like you're not going to get it every time, but if you can start trying to put that mode in place, that can help.
Absolutely. I mean, I don't know if we ever just all the way arrive. I think about my own personal life and how I'm still being parented as I parent children. So I don't know if we ever really arrive. I think it is, like you said, it's a journey we're constantly learning.
So you mentioned refusal skills. What are refusal skills?
So refusal skills are particularly around substances, is equipping young people with the ability to get out of a situation where they're being offered substances or tempted to do something that's wrong. It's not even just substance. It could be like, let's go take this car, let's steal this candy. But it's helping them first name the trouble, right? So you want me to take that candy from Mr. Williams? That's stealing. Like teaching your young person to say that's stealing, like something that might feel like not a big deal, helping them name that trouble, and then also equipping them with phrases that can help, like I can't do that, I'll get in trouble or it'll lead to this, and then helping them to make a plan when pressure is on them, like before it happens. This, you think about prevention. Before you ever get in a situation where you're being peer pressured, here are some things you can do. You can call me, you can text me, you can run, like just helping them think through what are their options before they find themselves in these situations that we know a lot of young people are likely to encounter as they grow older.
I love the idea of naming it too. Like that's stealing. Like don't try to justify it in your mind as anything else. This is what it is.
Yes.
So they can give you a call, they can leave the situation. Are there other like less obvious things you could teach them or ways you can teach these refusal skills?
Well, I think acting it out is really one that we've seen of, like, the caregiver pretending to be the person who's applying pressure and giving the young person an opportunity to practice saying out loud those things is a big one. I think it's one thing to talk about it, and it's another to try and kind of pseudo create those situations for them to act through. Is important.
It's like a way to practice. Like
Yeah,
if you're shooting a basketball, if you've done it 100 times,
yeah. Because the first time you say no to everybody else who's trying to push you to say yes can probably feel. I know, for example, it feels overwhelming. And so to get strong, I think of it as like a muscle, like building that muscle of being okay, of saying no, of doing the healthy thing, the right thing.
so the last one I heard you mention was create opportunities for involvement. What does that mean? What does that look like?
In the family setting, that could look like we are getting ready to make our grocery list for the week and giving an opportunity for young people to be a part of putting things on that grocery list. It could be about them going in the store and helping you pick up those groceries. It could be chores. It could be that we're going to have a family night on Friday and choosing the game or choosing the activity that we do. But it's anything you can think of to just kind of bring them into having a little bit of ownership in the family and value and stake in what's happening in the home is a great way to create opportunities for involvement.
I love that. You hear a lot about giving youth choices, and it's like giving them choices meets you're part of our team here in the collective family.
Yes, exactly. And giving them choices too within boundaries, sometimes we'll provide this training to families and they're like, well, I don't want them to know my budget. And it's like, maybe it's not that you're saying make the whole list, but they get to pick two snacks. So taking that in chunks that are feasible within your family context is really important.
What do you think about as far as like the boundaries or levels of involvement with all this?
Honestly, I think every family gets the opportunity to decide that for themselves, to an extent as well. And it gets back to this idea of what do you believe? Why do you believe it? Thinking about the teaching moments that can happen from the opportunities that you providing. Remember, when we're providing opportunities, we're also trying to build skills up in our young people. So, what can they learn also in these opportunities? You know, if it's the opportunity that you're providing is to have a night to clean the kitchen, what skills are you getting from that? So, connecting those things of like, what do you want them to be able to do when they leave as adults? And how do you start to build those skills early?
What is the difference between supervising your child and monitoring them? Like, we don't want to be following them every second to prevent any possible problem, but then we don't want to just be totally uninvolved. Where's the balance there?
That is really good, Bobby. So one of the things we think of is called GMC. So this idea of guidelines, monitor, consequences. And so supervising, when you say that, I think it sounds like just right on you. Every little thing you do, you can't breathe, you can't think on your own. Versus guidelines are like, let's put some parameters in place. So it might be that you have 2 hours after school and you know you need to do your homework and you know you need to do your chores. You get to decide at what point in those 2 hours you do it. And then monitoring is kind of assessing how they're using their time. And one of the key parts about monitoring is the ability to readjust. So if you see that they have their 2 hours and they always wait to the last 30 minutes to get their homework and chores done and it's creating this rush feeling, then you might come back in to readjust and help them think through strategies so it won't be so stressful to help them make a plan. And then there's consequences, and consequences can be positive or negative. And what we usually encourage is that you think through what those will be ahead of time and communicate them. So if you don't use your 2 hour window to do your chores and to get your homework done, maybe you're going to lose the iPad, you know, or whatever that consequence might look like. I don't know. I'm not all the way there yet. But so it's just that idea of like in your family, what makes sense of consequences. So it is this room for them to have some autonomy and make decisions. And it's also room for you to see where they're struggling and to help them build up those skills. And it's an iterative process. It's really not one and done. If you think about just young people developmentally, it's going to take multiple times for them to build that skill, build that muscle.
And then they kind of figure it out in their mind how to do it and be more self sufficient themselves.
Yes.
So last episode we were talking about, the broader community. This episode we're bringing it zooming it into the family. But what can the broader community do to support families when it comes to prevention?
Definitely. I think there's a couple things. The first that always comes to mind is education and providing resources. So, making sure that families know the relationship between risk factors and behavioral outcomes. Like making sure families know what might increase the likelihood of their young people experiencing suicide ideation or substance abuse or violence, and helping them understand these concepts that we talked about today, like equipping them with the skills. The other is really thinking through like what programs, what trainings, what curriculums can you make available in your community as well that can support parents and caregivers as they're on their journey to have that information. And then thinking about just the context, the laws, the norms, the support systems around, like, are they sending this message loud and clear that we want young people to be healthy and thrive? That could be really impactful.
So, in our last episode, we were talking about social development strategy. Could you briefly re explain that and then explain how that relates to families?
Absolutely. So the social development strategy is what we think about when we're trying to build bonding to get to healthy behaviors. It is the idea of providing opportunities, skills, and recognition for young people. When those three things are present, you then have bonding. And as a result of that bonding, then you're communicating your beliefs and your shared standards for your young people, and they're more likely to adhere and have healthy outcomes. So, in a family setting, we've already talked about the different opportunities that could be provided. It's building on that. The next step, though, is making sure you're being intentional about teaching the skills that young people need. So, when I say you have 2 hours to get your homework and your chores done, I don't just assume you know how to manage your time, but I'm actually taking the time to help you build that skill of time management. The other piece is recognition. I've heard people say, "So you want me to recognize them for doing what they're supposed to do?" Yes. Yes, we do. Doesn't it feel good when someone tells you good job? The same goes for young people. That is how you get to see more of that behavior you want to see. And it also creates closeness there that results in bonding. So I think it's that usually there are opportunities, but the next step for people to kick it up a notch is the skill building, the recognition, and then being really clear about what do we believe young people should be doing as far as behaviors.
So I want to bring this all home with the big question, which is what are the results of this? You do these things, what happens?
When you do these things, it gets back to this idea of we're going to reduce risk factors. We're going to reduce family conflict. We're going to reduce poor family management. We're going to increase protection. Our young people are going to feel connected. They're going to feel valued. They're going to feel equipped with skills. And so, all of these things, while it might be hard to see, ultimately it's going to result in healthy outcomes for them. They're not going to engage in substance, or they're going to be less likely to engage in substance misuse and violence and prevention and experiencing mental health challenges.
Thank you so much for this conversation. Next episode, we are going to take it to prevention at a broad community level. And I'm looking forward to talking with you soon.
Look forward to it.
Thank you, Capetra. Next episode is part 3 of 3. We are going to be talking about coalitions. This is when communities come together, do an inventory of where the gaps are in their community, and start implementing new prevention strategies. This is the Parental Compass. I'm Bobby Williams. We'll see you there. Peace.